Hi everybody, I am Dr. Pradisha. Now I am discussing about cellular adaptation. Okay, what is cellular adaptation? In this kind of situation, adaptations are reversible changes. In which are the conditions their adaptations are reversible changes means in their size, number, phenotype, metabolic activity, or functions of cells in response to changes in their environment. Cells must constantly adapt even under normal conditions. Also, the cells must constantly adapt their normal condition to change in their environment. These physiological adaptations usually represent response of cells to normal stimulation by hormones or endogenous chemical substance. Certain hormones and endogenous chemical substance may lead to its response. Response may lead to cellular adaptations. Okay, then cellular adaptations. There some different conditions. Some different conditions may adapt themselves by it may lead to cellular adaptations. What are they means? First one is hyperplasia. Second one is hypertrophy. Then third one is atrophy. Then fourth one is metaplasia. Then fifth one is dysplasia. Okay. Then first one is hyperplasia. Second one is hypertrophy. Then third one is atrophy. Then fourth one is metaplasia. Then fifth one is dysplasia. Okay. Then first one is hyperplasia. In hyperplasia, it's an increase in the number of cells in an organ or tissue. That is hyperplasia. That is increase in the number of cells. Sometimes it may be in our organs or sometimes it's in tissues. That is hyperplasia. Then next the physiological hyperplasia. What are the physiological hyperplasia? In physiological hyperplasia, first one is hormonal hyperplasia. It's anything, some hormonal stimulation will happen. The hormonal hyperplasia will occur. In this, hyperplasia of the female breast epithelium at puberty or in pregnancy. In both these conditions, the hormonal hyperplasia will occur. Then next one is normal endometrium after a normal menstrual cycle. Then also prostatic hyperplasia in old age. These are the hormonal hyperplasia. Okay. Then next one is compensatory hyperplasia. In compensatory hyperplasia occurred before one where the removal of part of an organ or contralateral organ in paired organ. Any removal part of organ. Then in this happen, the compensatory hyperplasia will occur. In this, regeneration of the liver following partial hepatectomy. If in liver transplantation, this will happen. Then also regeneration of epidermis after skin abortion. Then following nephrectomy on one side, there is hyperplasia of nephrons of other kidney. These are the compensatory hyperplasia. These are the compensatory hyperplasia. Then one is pathologic hyperplasia. Pathologic hyperplasia in this due to excessive stimulation of hormones or growth factors. Due to excessive stimulation of hormones or growth factors. That is example, skin warts from hyperplasia of epidermis due to human papillomavirus. We all know that human warts are due to human papillomavirus. This is the pathological hyperplasia. Okay, right. Then these are the hyperplasia. Then next one is hypertrophy. Hypertrophy means it's an increase in size of parenchymal cells resulting in enlargement of organ or tissue without changing number of cells. Without changing number of cells, in hyperplasia, there is an increase in number of cells. But in hypertrophy, without changing number of cells, the enlargement of organ or tissues will happen. Then what are the types of hypertrophy? First one is physiological hypertrophy. Then next one is pathologic hypertrophy. In physiologic hypertrophy, it's a simple example: enlargement of size of uterus in pregnancy. That is a physiological hypertrophy in example, simple example. Then next one is pathologic hypertrophy. In pathological hypertrophy, there is hypertrophy of cardiac muscles occur in number of cardiac disease. There is left ventricular hypertrophy, aortic stenosis, mitral regurgitation. These are the examples for hypertrophy of cardiac muscles in cardiac disease. The next one is next pathological hypertrophy is hypertrophy of smooth muscles. In hypertrophy of smooth muscles, example achalasia cardia and a pyloric stenosis. These are the example for hypertrophy of smooth muscles. The next one is hypertrophy of skeletal muscles. Here hypertrophy of skeletal muscle example is hypertrophy of muscles in athletics. Then next pathological hypertrophy is compensatory hypertrophy. In compensatory hypertrophy, when contralateral organ is removed, example kidney. There is when contralateral organ is removed, the compensatory hypertrophy will occur. Okay. Then what are the pathologic changes will happen in hypertrophy conditions? Affected organ is, already I told you. There is no numbers and there is no change in number, but only the size only occur increased. So affected organ is enlarged and heavy. There is enlargement of muscle fiber as well as this nuclei. Also at the ultra-structural level, there is increased synthesis of DNA and RNA. Then also increased protein synthesis, also increased number of cell organelles. These are the pathologic changes. These are the condition under hypertrophy. Then next one is atrophy. In atrophy, the reduction in number and size of parenchymal cells of an organ or its part which was once normal is called atrophy. There is reduction in number and size of parenchymal cells of any organ or its part which once normal. When it is normal, it is called atrophy. It's also two types are there: physiological and pathologic. Physiologic and pathologic. Physiologic and pathologic. In first one is physiologic atrophy. In physiologic atrophy, a normal process of aging in some tissue. It's again, you all know that the normal processing of aging in each cell is having involved way. So, a normal process of aging in some tissues, which could be due to loss of endocrine stimulation or atherosclerosis. There is this process of aging of some tissues mainly due to endocrine stimulation or atherosclerosis. Then also atrophy of lymphoid tissues in lymph nodes, appendix, thymus. Also another example is atrophy of gonads after menopause. Then another one is atrophy of brain with aging. Okay, these are the physiologic atrophy. Then next one is pathologic atrophy. Example for pathologic atrophy means starvation atrophy, ischemic atrophy, disused atrophy, neuropathic atrophy, endocrine atrophy, pressure atrophy, idiopathic atrophy. These are the some of the examples for pathologic atrophy. Okay, first one is starvation atrophy. In starvation, there is first depletion of carbohydrates and fat stores followed by protein catabolism. In starvation, we all know that the metabolism will distract, and what will happen? There is first depletion of carbohydrates and fat stores followed by protein catabolism. There is general weakness, emaciation, and anemia referred to as cachexia. There is first one general weakness, then emaciation and anemia referred to as cachexia. Then next one is ischemic atrophy. In ischemic atrophy, gradual reduction of blood supply due to atherosclerosis may result in shrinkage of affected organ. Example, small atrophy kidney in atherosclerosis of renal artery. In this, the small kidney one kidney will be small in size and other one will be in normal in size. That is the example for small atrophic kidney in atherosclerosis of renal artery. Then diffuse atrophy. In diffuse atrophy, prolonged diminished functional activities associated with the disease associated with the diffuse atrophy of the organ. This is the diffuse atrophy. Then in its example is atrophy of pancreas in obstruction of pancreatic duct. Example is atrophy of pancreas in obstruction of pancreatic duct. This is the disease atrophy. Then next one is neuropathic atrophy. In neuropathic atrophy, interpretation in nerve supply leads to wasting of muscles. Example, poliomyelitis. We all know that poliomyelitis is the condition where the muscles will be wasting. So, okay, then the neuropathic atrophy will be happening in poliomyelitis. The next one is endocrine atrophy. In endocrine atrophy, loss of endocrine regulatory mechanism results in reduced metabolic activity of tissues and hence atrophy occurs. Its example is hypopituitarism may lead to atrophy of thyroid, adrenal and gonads. This is the endocrine atrophy. Then next one is pressure atrophy. In pressure atrophy, prolonged pressure prolonged pressure from benign tumor or cyst or aneurysm may cause compression and atrophy of tissue. Compression and atrophy of tissue. Example, erosion of spine by tumor or nerve root. Any erosion or tumor arise from nerve root or spine is pressure atrophy. It will lead to pressure atrophy. Then next one is idiopathic atrophy. In idiopathic atrophy, in some cases there is atrophy with no causes. In this condition, there is without any cause. Example, myopathy. This is the idiopathic atrophy. Okay, this is the what types. Then, what are the pathological changes happening in atrophy? Then, in pathological changes, atrophy means the organ is small and shrunken, smaller in size, but not dead cell. There is no dead cells will occur. Also, number of cells became reduced. Then, shrinkage in cell size due to reduction in cell organelles, chiefly mitochondria, myofilament, and endoplasmic reticulum. These are the happening, what are changes, pathological changes here of atrophy. Then, these are the atrophy. Atrophic condition. Then next one is metaplasia. In this, what do you mean by meta? Meta means transformation. Then plasia means growth. So metaplasia is defined as a reversible change of one type of epithelial or mesenthelial adult cell into another type of adult epithelial or mesenchymal cells, usually in response to abnormal stimuli, and often reverse back to normal or removal of stimulus. In this, there sometimes it may normal or removal of stimulus will be happen. Then also, if the stimulus persists for a long time, epithelial metaplasia may transfer into cancer. If there is stimulus, this stimulus will persist means the long term means this epithelial metaplasia may transfers into the cancer condition. So, what are the causes of metaplasia? First cause means changes in environment. The first cause is changes in environment. Changes in environment. The next one is irritation of the next cause is irritation or inflammation. Irritation or inflammation. Or then next one is nutrition. Next one is nutrition. So there is mainly mainly three causes there. First one is changes in environment. Then second one is irritation or inflammation. Third one is nutrition. Okay. Then what are the types of metaplasia? This one is what are the types of metaplasia? First one is epithelial, and the second one is mesenchymal. So first one is epithelial and the second one is mesenchymal. First one is epithelial metaplasia. In epithelial metaplasia, it is the common type of metaplasia. In this, there is two types of there, squamous and columnar metaplasia. In this, two types of there, squamous and columnar metaplasia. This one is squamous and columnar metaplasia. Columnar metaplasia. First one is squamous metaplasia. In squamous, the first one is squamous metaplasia. In this, various types of epithelium are capable of undergoing squamous metaplasia. There is changes due to chronic irritation that may be mechanical, chemical, or infective in origin. There is what are the example for squamous metaplasia means? First one is in bronchus. That is in bronchus. Chronic smokers, they normally land by pseudo-satisfied columnar ciliated epithelium in bronchus. But in chronic smokers, that may undergo squamous metaplastic changes. That may undergo squamous metaplastic changes. Here, next example is in uterine endocervix. Normally the endocervix is the uterine endocervix is covered by lined by simple columnar epithelium. In prolapse of uterus, it in old age, there is the endocervix will be occur. Then in gallbladder, in chronic cholecystitis with the cholelithiasis, normally land by simple columnar epithelium. But what will happen? It will lead to metaplastic changes. With squamous, metaplastic changes will be occur. Okay. Then next one is in renal pelvis and urinary bladder, normally lined by transitional epithelium, but in chronic infection and stalls, what will happen? The squamous metaplastic changes will occur in renal pelvis. These are the squamous metaplasia. Then next one is columnar metaplasia. Columnar metaplasia, in some condition which there is transformation of other epithelium to columnar epithelium. In some condition, there is transformation of other epithelium to columnar epithelium. In this first example is intestinal metaplasia in healed chronic gastric ulcer. Next one is columnar metaplasia in barred esophagus, in which there is change of normal squamous epithelium in esophagus to columnar epithelium. And in another example is change of pseudo-stratified columnar epithelium in chronic bronchitis and bronchiectasis to columnar epithelium. These are the important three examples for columnar metaplasia. Then these are the epithelial in metaplasia. The epithelial metaplasia discussion is over. The next one is mesenchymal. Next one is mesenchymal metaplasia. Here is a transformation of one type of mesenchymal tissue to another. Example is osseous metaplasia, and the second one is cartilaginous metaplasia. First one is it is the formation of bones in fibrous tissue, cartilage, and a myxoid tissue. These are the osseous metaplasia. The next one is cartilaginous metaplasia. Cartilaginous metaplasia, in healing of fractures, cartilaginous metaplasia may occur. Then these are about metaplasia. The next one is dysplasia. In dysplasia, disordered cellular development often accompanied with the metaplasia and hyperplasia. That means there is a accommodation development of often accompanied with the metaplasia and hyperplasia. These are the types for metaplasia and hyperplasia. Also known as typical hyperplasia, commonly seen in epithelial cells. So dysplasia is commonly seen in epithelial cells. It is characterized by cellular proliferation and cytological chances. Then the changes. What are the changes will happen in this dysplasia? Hyperplasia of epithelial cells will occur. Also, disordered arrangement of cells from basal cells to the surface layer. Also, loss of basal polarity. That means nuclei lying away from basement membrane. Then also cellular and nuclear pleomorphism. Then also increased nucleocytoplasmic ratio. Then the next change is nuclear hyperchromatism. Then next one is increased mitotic activity. These are the changes will occur in dysplasia. Then also commonly dysplasia is seen in uterine endocervix and respiratory tract due to chronic irritation and prolonged inflammation. In some cases, it may lead to carcinoma in situ, carcinoma in situ, or also known as invasive carcinoma, invasive cancer. Dysplasia. So with this, cellular adaptation is over. Thank you.